Welcome, my name is Peter Strong and I provide Skype therapy for anxiety and depression and other common psychological problems that don't require medical attention. Um, Anxiety and depression respond very well to some basic mindfulness techniques that I've developed over the years that help you basically stop the habitual process of becoming overwhelmed by your emotions. This is one aspect of mindfulness we focus on in great detail. It's called learning to sit with your emotions, learning to build a relationship with your anxiety or depression or any other emotion in which you can sit with it without becoming reactive, without indulging in the reactive thinking and reactive behaviors and reactive identification that feeds the anxiety or depression. If you can learn to sit with your anxiety or depression without feeding it, then the anxiety or depression will lose its strength. It will begin to change. It will begin to resolve itself. And this can happen quite quickly. The main key here is not to feed the anxiety or depression with reactive thinking and rumination or what if thinking or any other form of reactivity. The second part of mindfulness therapy that we focus on during these Skype therapy sessions involves looking at the imagery of the emotion. All emotions have corresponding imagery, and that is really how the mind keeps that emotion intact. The imagery will have certain characteristics that we explore during mindfulness therapy. For example, position. That's a very important one. Color, size. All of these factors are what actually make the emotion work and cause the anxiety or depression. For example, for depression, the chances are that the emotion will be very dark in color, black. It's likely to be very heavy. It's experienced as something weighing heavily on you. Chances are it's also going to be overwhelming, which means it's above you. That's how we see it inside. Psychologically, that's the imagery of the depression, and that's what makes the depression work. When you change that imagery, you change the depression. So seeing this imagery is vital if you want to change the underlying process that causes depression. For anxiety, it's very common to feel that anxiety in the chest region. That's its position. If we can change its position and move it out of the chest region, then you will be changing the structure of the anxiety. And that's a very important part of healing anxiety. So working with imagery is very, very effective indeed. The third part of mindfulness is really learning to discover who you really are, your true self. And your true self is not the contents of mind. It's not thoughts, it's not emotions, it's not memories, it's not beliefs, it's none of those things. Your true self is actually that quality of awareness, consciousness, that can see and experience the content of mind. And that is not content. It's outside of content. Most of our suffering occurs because we become identified with the content of our mind. We become attached to it, we become caught up in it, we become lost in it, we become overwhelmed by the content of mind, and we suffer. During mindfulness therapy, we learn to move out of the content of mind to find our true identity, which is this consciousness that is able to witness the content of mind. And the analogy we often use here is the sky. The sky represents your true self. The clouds and other objects that arise and pass away, those represent the thoughts, emotions and memories and other content of mind. The sky does not change. Contents change. The sky remains constant, and the sky does not suffer. Your true self does not suffer. It is only the emotions and the thoughts and the content that suffer. So this is one very important result of working mindfully with your emotions and your thoughts. You begin to discover your true self, and that's very, very exciting indeed. So if you'd like to learn more about mindfulness therapy, and you'd like to schedule a Skype therapy session with me, simply go to my website and email me. Thank you.